Welcome to this week's edition of the Medical Center Show, keeping you healthy in Hudson County. Today we have a really special guest, a new member of our medical staff, Teresa, Brennan, Turri, who is a nurse midwife. It'll be a great show today. We'll be right back.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to the Medical Center Show. Today I am so happy to have our guest, Teresa, Brennan, Turri, who is a new nurse midwife at the Medical Center. She's actually the first nurse midwife who's come to the Medical Center, and we're so happy to have her as a member of our team. Welcome.
Thank you.
Tell us a little bit about yourself. How do nurse midwives get trained? You know, tell us a little bit about, so did you start out as a nurse?
I did. I started out as a nurse.
All right.
And I'm a little, it's been 30 years.
Oh, no, you don't look like 30 years.
No
way.
And then I decided, to go on.
Okay.
And I went on after having my own 4 children.
Oh, good.
And went back to school and
right.
finished grad school with my master's in nurse midwifery in 2002.
Okay.
So I've been practicing since.
That's great.
And delivering good, healthy babies.
Good.
Different parts of New York.
So where did you do your training?
Well, I was at SUNY Stony Brook is where I got my midwifery degree.
Okay. Mm-hmm. And it takes 2 years to learn to be a midwife?
It basically takes 2 years. Now there's different pathways in. That's 2 years beyond a bachelor's degree.
Right.
So it's a master's level degree.
Okay.
Some people do go on also and get doctor of nursing practice.
Right.
But you can start out being an RN, or you could be a person who's very interested and has a science background,
right.
and decides to go back to school for midwifery. But basically, it's the crux of it is looking at the physiological, practice of birth, the
right.
normalization,
right.
and being able to identify when things are not normal,
right.
so that those things can be further evaluated, either in
Sure.
collaboration, consultation, co-management,
right.
sometimes, or just passed off to, the MDs.
To the MDs, okay. So talk a little bit about how what a nurse midwife does is different than kind of what an MD does. Because philosophically, there's some little bit of differences, right? So,
right.
And a lot of women want a nurse midwife rather than a doctor.
I hope so.
Yeah, right?
I hope a lot.
Well, that's why you're here at the
Hudson
Medical
County.
Center, because we keep hearing that women are looking for an alternative to the traditional MD-based, OB practice.
Well, that's true. I mean, there's with alternative and complementary medicine gaining a lot of popularity.
Right.
There's another resurgence because there has been, areas of hills and valleys
right.
in midwifery where it's become popular, then not so popular. I think recently the push by World Health Organization and lots of other, National Institute of Health, lots of other big organizations towards getting away from primary cesarean sections,
right.
okay? In other words, a woman getting a C-section when she's in labor
right.
For the first time, and then even though traditionally it used to be if you had a C-section, you always had to have a C-section,
right.
that was dispelled years ago, but it became just very convenient for women to say, okay, well, I think, I went through all that last time and I had a C-section,
right.
so maybe this time I'll just schedule a C-section.
Right.
So with healthy people, 2010 and now 2020, we want to get a healthier population out there.
And there are
complications.
Yeah, major risks, right, to
major
C-sections.
Risks and
right?
complications that people don't think about on a daily
right.
basis.
And in this area and in New Jersey, the C-section rate's very high.
The C-section rate nationwide is probably between 25 and 30%. It's always changing. In this area and in the New York City area, we're in the metro area, it's gotten upwards towards 35 to 40% at some points in time. And so now we're hoping to be bringing that down. I have to say that in my practice at Mount Sinai, with other midwives, last year our cesarean section rate was 13%.
Wow.
And that included our patients that we transferred to MD care during labor.
So, because that's really amazing. So you were at Mount Sinai before you came to the medical center?
I was at Mount Sinai for the last 7 years.
Okay, great.
I was full-time for a year and a half, 2 years, and then I was teaching, so I was doing it part-time.
Wow.
And
so how many babies do you deliver in a year, usually?
It depends on the year. When I was teaching as well, I delivered less babies. I used to be in a practice before that up in Nyack, New York, and I delivered 4 or 5 babies a night. A couple of nights a week. Yeah. Sometimes it's like that at Mount Sinai as well. It's a very, very busy practice. Here, I'm the only midwife, so I'm very excited to start delivering babies.
Sure.
But once I start delivering a few babies a day, you're going to have to get me some help.
There you go. Okay, well, we'll do that for sure.
We'll grow the practice.
Well, the other night at the medical center, I got a call at home because we had 16 moms delivering at the same time. So you can only help bring to that. But, the most important thing is to really deliver the baby as safely and as comfortably as possible for the mom.
Yes.
So philosophically, tell everybody what's the difference between what your approach is, kind of what the MD approach is. And I know everybody wants the best outcome for the mom and the baby, but you have some techniques that are a little bit different than the MD approach?
Well, the thing about the midwifery model of care as opposed to the medical model is we do a lot more standing back and trusting in nature and watching how things go. Okay. Now, that doesn't mean that we deliver a different standard of care. We deliver a very high standard of care. However, we will work with the woman and her body to try to help her to experience birth as I want what she wants. If she wants an epidural, then that's fine with me. If she wants to do things as naturally as possible, that's fine with me.
So you have that kind of discussion with women up front,
it's very important. It's very important when choosing any care provider that a woman, especially a woman, because they have so many unique needs and surrounding childbirth and just women's health, that they have a provider that they really can trust in and feel respected by, and that they are heard. And that's the hallmark of midwifery care. It's listening to women.
And you've delivered 4 babies of your own.
My own.
So you've got the first-hand experience, right?
I've got in the trenches experience.
That's great.
As well. But as far as midwifery and medical model, we just, we are trained in most of the interventions, and I've also assisted on cesarean sections as well. So I can stay with the woman throughout the process if it becomes
It's not
a
like,
need.
oh, you're going to have a C-section and I'm going to leave you,
I never abandon my patients. But the thing is, it's like, whereas I might wait for her water to break or wait for certain things to take place, like the baby's head to come down a little more, the doctors might be like, well, let's break the water because we know that speeds things up. I mean, doctors are more focused on, and it's nothing against them, but they're more focused on diagnosing and treating illness, whereas midwives are more focused on caring for the whole woman, psychologically, what's going on in her mind, what's going on within her family. Her needs are going to change based on all of those different things. She has social needs, different context than
We'll be right back with Teresa, Brennan, Turri, and talking a little bit more about nurse midwifery.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Welcome back. We're here with our nurse midwife and brand new member of the medical staff at Jersey City Medical Center. So tell us a little bit, so you talked a little bit about kind of developing a relationship with your patients and how you listen to them and really take time with each patient. Why is that important as they...
Well, I think it's important because, there are also a lot of women out there that would like to deliver as naturally as possible and maybe even in their home, but I don't offer that.
Right.
And, the general feeling is that, I think for the general public, especially in the metro areas, is that they want the safety net of the hospital.
Sure.
They want to know that, if they need something for their baby or for themselves, medically something becomes emergent, that it's available.
Right.
So I in fact, I spent a long time the other day speaking to a woman just about her unique needs.
Right.
What are the needs of hers based on her family and what she's going through, where she's at in life.
Right.
And, then people may have different anxieties about the pain and worrying about coping and maybe they want to have a strategy.
Sure.
And some people will say to me, husbands and wives, partners, well, what if we say that no matter what, even if she asks for it when she's in pain, that she doesn't get any pain medicine because we know now she doesn't, and it's just not really realistic.
Right.
And I try to get people to understand that it's great to have a good idea about what you want,
right.
but let it, especially with the first labor, let it evolve as it takes place and
right.
see how you feel at the time.
Sure.
And if you do decide that you want something for pain or you want to do something that you hadn't planned on, well, then that's okay.
Right. So because the most important thing is a good outcome for the mom and the baby.
The most important thing is healthy mom, healthy baby.
Right. So you might use some techniques that traditional medical doctors may not. Tell us a little bit about some of the methodologies you might use to help a woman during their laboring process.
Okay. Well, it's been known that, you see everybody walking around with their iPods and their cell phones with the music. And so music, calms the savage beast.
Right.
We know that, right?
Yeah.
But I mean, it helps people to center
Sure.
themselves.
Right.
It helps people to focus. And it's a distraction.
Sure.
And it also blocks out, any surrounding noise in the room or the area.
Right.
Now here we have a very nice unit, and we're
right.
about to undergo a little bit of a facelift.
Yeah, we are.
And it's very nice. The rooms are like twice the size of my
right.
rooms at Mount Sinai.
Really? Yeah.
And they're very nice. And so we want to make it as home-like as possible.
Right.
And so I've requested to get some, and you can help me with this.
Sure.
To get some facilities to put their iPods, into a dock so that they could listen to them, make the music in the room,
right.
whatever is comforting for them. Also things like aromatherapy, massage, teaching dads and partners.
So tell me a little bit about
techniques.
aromatherapy.
Aromatherapy, like lavender is a very calming one. A lot of the citrus
So you
smells
actually
can
put
be
that
helpful.
in the room and have an aroma?
We can put it in the room. We can put it in the shower. We can,
Right.
I love hydrotherapy. We
Right.
don't have tubs yet.
Right.
Wink, wink,
Wink,
but
wink.
hopefully those will be coming someday.
So-
but hydrotherapy helps to relax a woman.
Okay.
When she's relaxed, her uterus can work and do its job.
So you were looking for a couple of jacuzzis in the
I'm looking
LDR
for some
rooms? Is that what you're looking
jacuzzis,
for?
Right.
Okay. All
But
right.
but a shower can work as nicely,
Right.
and a lot of times putting a chair in a shower, and getting them in there just to let the water go on them, and it really does help them to relax.
Oh, it does.
It does. And if they're relaxed, the uterus is a muscle, it's going to contract.
Right.
It's not going to stop if you hang on to the furniture. I tried that,
right.
and it didn't work, and I ended up with a cesarean the first time. But it doesn't stop the pain. What they need to do is learn to work with the pain.
Right.
Okay? So I try to keep them as upright and mobile as possible.
Right.
Eating lightly, drinking. I don't look good in spaghetti and meatballs or Chinese, so when someone's
right.
really booming in labor, they wouldn't have those kinds of options. But up and around and moving until they get into a rocking chair or then maybe possibly the bed to lie down, then the bed's going to feel good.
Right.
And then we can do things like, adjust the bed. So like back
So we're
labor.
buying new beds
We're buying
for the
new beds.
labor and delivery. We're going to upgrade.
We're gonna
It sounds like we're
upgrade.
going to buy a couple jacuzzis so you can kind of have
Hopefully,
some
we're going to also have
hydrotherapy.
the squat bars on the bed so that
really?
women can, they
Okay.
can be in different
So
positions.
really state-of-the-art for women
State-of-the-art
who...
stuff,
who-
top of the line.
Right, top of the line. And it will help facilitate delivering naturally versus having a
Right,
C-section.
supporting the physiologic process
Great.
of birth.
Okay.
And so, so for women in back labor,
Yeah.
okay, a lot of times what we do is get them on their hands and knees if possible.
Right.
And I can adjust the bed so they don't have to be on the floor or anything.
Right.
Cover them so that,
Yeah.
they feel that their privacy is maintained, and, teach the husband or partner how to apply pressure to their lower back. Want to
Okay.
see my
Sure.
my
Yeah,
props
let's see.
that I brought along today?
Let's see.
So sometimes
gonna show us how a baby is delivered.
This is the
Uh-oh.
pelvis.
So that's the pelvis.
Yes, and this is Junior with his or her. It's ambiguous. Don't worry.
Okay.
And umbilical cord and the placenta, which is attached
Right.
on the maternal side to the uterus, and on the fetal side encompasses the membranes and everything. And so back labor, a lot of people have concerns about pain in labor, and back labor is one of them. So what happens is that when a patient has back labor, it means that, okay, instead of the baby's head facing, looking
Right.
down towards the floor, in order to fit, the baby does a series of turns, okay, to negotiate the pelvis.
Okay.
So that's why being up and around, if I'm laying down and I'm in the same position and he's here and his head is banging because of, whatever, to try to mold into the pelvis,
Right.
there's different bones in the head, the two parietal
Right.
bones and the occipital. And these can override each other, and that's why you get the cone head or the kind of rocky road head. And
So my first
that all
son had a cone
simmers
head.
down. Yeah, because it can shape to fit through the pelvis.
Right.
So the pelvis it's pretty neat, and this is almost life size. I'm not that small, but maybe for like a 10-year-old or something pelvis. But anyway, so there are different shapes of the pelvis. It can vary in shape. So anyway, so the baby, as it's coming in, depending on the baby's position, the mom's position, he's going to have to make a series of turns to fit through.
Okay.
Okay. So at one point he may be facing not the optimal way to fit through, which would
Okay.
be with his head not looking at the floor.
So this is the
for
spine
delivery.
here?
Yes.
This is the spine?
Yes.
Okay.
But looking towards the ceiling. So this is
Right.
this is the bones of the pelvis, all right? And this would be the sacrum and the coccyx.
Right.
And this would be the pubic bone. And the baby has to get under the pubic bone and to deliver.
Okay.
So anyway, so when he's coming through, if he's facing like this, okay, where he wouldn't be, head down with these bones being able to mold,
Right.
you could see that the majority of the weight of the baby would be against the mom's back.
Right.
Okay, and that's why when they have a contraction, instead of feeling it in the front and this tightness coming around, they're feeling it like their back's going to explode open. It's just
okay.
going to blow open.
Right.
And so things that we can do to try to help the baby to turn, mom gets on her hands and knees, and you can see right away, it's like if you transfer,
taking the pressure
you're
off the
taking
back.
the pressure off the
I
back.
see.
And then we teach dads and partners how to do counter pressure, like press against there, it interrupts the pain impulse to the brain. And also getting up and moving around, being on, I can't do it today because I'm in a
Right.
skirt, but being on hands and knees and like maybe just rocking side to side might give a little momentum if you think about physics,
Right.
and help that baby to turn into a better position for delivery. Okay?
Right.
So, but basically there's a series of turns that they have to do to come in and go under the pubic bone, and then even when they come out, they make a couple more turns on the way out, and then there you have it. Baby's born.
Okay, so we're going to talk more about this fascinating delivery. Wait, you can't lose your props yet. I want to talk more about your props, but we'll be right back.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Welcome back. We're here with our brand new member of our medical staff, our nurse midwife, and we were talking about delivering babies and all that great stuff. So tell everybody, because you obviously have tons of experience, worked at Mount Sinai. You're
in other places,
yeah,
and
in other
I've
places.
taught, and
great, and you have your own kids.
I do.
And it sounds like you're somebody who listens very intently to what the moms want as they go through this process. Tell us a little bit about your office is in Hoboken, and so you're working for the medical center.
I'm working for the medical center
Right.
within the faculty practice, so
Right.
I have, the great thing is that multidisciplinary at
So
my
it's not just
disposal.
you have the doctors
The
available.
doctors are available, backing me up. I'm in
Right.
collaboration. Every month we discuss all of my patients that are,
Great.
that are in labor and,
Sure.
pregnant rather. And, so that they're available to consult, collaborate, co-manage, or even transfer care if
Wow.
need be.
That's great.
So they're always there and always available. And it's a very interdisciplinary approach. But I see patients right now in Hoboken 2 days a week.
Okay,
In
so
the Hoboken
the
office.
Hoboken office is right opposite the
2
PATH
Hudson
station.
Place. Get off.
Two Hudson
get
Place.
off the train and come right in.
So-
right after I'm doing evening hours.
Oh, are you
on
doing
Thursdays.
evening hours? Okay, great, good.
Up
So
until 6
somebody who's
o'clock.
working in the city takes the PATH, can come see you on a Thursday night,
Right,
and
exactly.
that's great. That's really,
And then I also have hours available during the day.
Okay.
And I'm also going to be in our office building.
in the medical
here
office
at the
building
medical
at the
center.
medical center. Okay, great. So there's tons of places where people can come. Anybody who wants to take the light rail, they can take the light rail. It's right across the street from
Yes,
the medical
I
office
did
building.
it myself.
You did it? Oh, good.
I
Good,
did.
good,
I
good,
tried
good.
it out.
Yeah.
Very convenient.
Yeah.
Very nice.
That's great. So your office in Hoboken, you're there 2 days a week?
I'm there 2 days a week right now. I'm there Wednesdays from 10 to 2,
Uh-huh.
which could expand.
Right.
And I'm there on Thursdays from 1 to 6
Okay.
presently,
Great.
which again, if
Good.
the need arises,
Right.
we stay later.
And if you
We
want to stay
put
after
in more
hours, or somebody
hours.
wants to
Right.
come for an evening appointment, you're available to do that.
Well, and that's the difference. That's
Yeah.
again the difference between myself and some, physicians. It's like,
Right.
I'm not getting called off to perform surgeries all the time.
Right.
I don't have to be, obviously I have to come in if my patients are going to deliver.
Right.
But they have a lot of different responsibilities outside of what I do.
Right.
And so I have the opportunity to spend a lot more time with my
Sure.
patients.
Now, at the medical center, you talked about some of the services that we provide, like massage therapy and things like that.
Yes,
So
we
talk a little
have,
bit about some of the special things we do at the medical center.
Okay, we've been offering, even before I came, prenatal yoga classes.
Right.
Okay, and we're also offering massage and infant massage.
Okay.
Okay, and nutrition classes.
Right.
And
And we have a huge breastfeeding initiative, right?
Yes, I was just going to mention that. I'm very involved in Baby Friendly, and I've been involved in it in other places as well. The Baby Friendly initiative, which is, again, a spin-off of the Healthy People goals.
Sure.
So that we get babies breastfed, as many babies as possible, to breastfeed for 6 months to a year. 6 months exclusive is the recommendation of American Academy of Pediatrics,
Right.
and up to a year with other foods introduced at about 6 months. Now, we're doing that, and we're doing that throughout the hospital, working together with different departments, and we have a lot of people involved. And it's going to be really good for moms and for babies. But it's just a way of promoting breastfeeding and really supporting women in their attempts to breastfeed, so that if that's what they choose, that they can be successful.
Right.
It doesn't mean that we're pushing it down their throats. It doesn't mean
Right.
that they have to. If they, if they have some breast tissue or implants, or they have some other reason that they're uncomfortable or anxieties or we're totally accepting of that.
Right.
It's no judgments. But if someone wants to breastfeed, we want to support them as much as possible.
Right, and you want to make it happen for them, because
We wanna
sometimes there
make
are
it happen.
difficulties with breastfeeding.
Yes, and I breastfed all my babies,
Right.
and one of them I had a lot of difficulty with in the beginning,
Right.
but it's learned behavior.
Sure.
And so there are breastfeeding classes that are offered, and that's the best way to start, is to get some education
Right.
before the baby's actually here.
Now, so you don't just deliver the baby and then boom, you're done, right? I mean,
no.
you
No,
have
I'm there.
postpartum care,
Yes,
you
I
provide
do.
care in the hospital,
I do.
and right.
I do. I provide care in the hospital. I stay with the moms after the baby delivers,
Right.
help them to nurse the baby, you know, after, if there's any repair that needs to be done,
Mm-hmm.
you know, help them to nurse the baby, get settled with the baby, visit them daily until they go home. And then I'm instituting a callback system where I call back my patients within a week
Okay.
and speak to them and see how everything's going, see if there's any issues, because I want to give them that support, you know, very
Right.
much on the lookout for any signs of postpartum depression or anxiety.
Sure.
Any signs that there's any difficulties with the baby or with the mom, you know, with adapting.
Right.
And so, you know, many of our moms are going to be working professionals, and they have concerns, and it's
Well,
they
especially
may have
first-time
demands
moms,
of
right?
work too,
They're
like
all- yeah.
even when they're
Yeah.
supposed to be on maternity
Yeah.
leave, they may be still, you know, having things on their mind. So
So it sounds like you have a really personalized approach to moms, right?
very, yes.
Yeah.
You know, I appreciate it that I had some really great care providers that took
Right.
care of me when I had my children, and you know, I like to pay it forward, and,
Right.
and I like to bring that to
So
everyone.
the medical center is relatively new. We have those beautiful rooms, we have a beautiful
Yes.
labor and delivery, we have a beautiful postpartum area. We're getting ready to do.
We're going to have a baby fair.
Okay, well, wait,
We're
but
gonna-
before we do the baby fair, we're going to renovate the whole area. It's really
Renovating,
going to
gonna
be beautiful,
yes,
right?
it is. It's beautiful already,
Yeah,
but it
but
needs
we
a
wanna
little.
spruce
you
it
know,
up a little bit,
We want to
right.
make it a little homier.
You probably want to find some jacuzzi tubs to put in there
I wanna
too,
find some-
right?
I want to find
Yeah.
things that are going to make it more relaxing
Right.
and more comfortable, more of a
Right.
home-like environment.
Right.
We're looking into offering packages of.
So we should
you know,
be done all this
personalized
renovation
materials.
in the fall time, and then you are coordinating a baby fair. So tell everybody what that baby fair is all about.
Okay, well, I've been involved in baby fairs before when
Mm-hmm.
I worked in upstate New York, and they're really fun, and they're great. And it's a way of, you know, getting everybody in the community together.
Right.
Bringing everybody onto our campus so they can see our beautiful, you know, relatively new medical center and our unit.
Mm-hmm. New renovations will be done by then.
New renovations,
Right.
and just, you know, our Starbucks in the lobby
Yes,
and
yep,
gelato. And that's one of my favorite stops.
Right.
But I'm going to have people there from different businesses. It's going to
Okay.
be in the fall. Date is TBA.
And we're going to
sometime
have
in
the
September.
chamber supported
We're
also.
going to have we're going to have chamber support. We're going
Right.
to have donations of, you know, let's say like a spa experience.
Okay.
We're going to have on-site, you know, demonstrations of massage and infant massage.
Okay.
We're going to have a little prenatal yoga. We already offer those classes, but, you know, just to get people
Right.
to see. And even if they're not delivering with us, they can stop by and they
Sure.
can come on in. We're going to have something for grandparents, a little daddy's boot camp.
Oh, good.
We're going to have something for everybody.
Well, it sounds like a really, really great idea, and
Yeah.
we're really looking forward to it. In the fall time, keep an eye on our website. We'll be giving more updates on the Medical Center show about our baby fair in the fall. Teresa, thank you. I'm so happy that you've joined the medical staff at the Medical Center. I think you'll be
I'm
a
happy to be
terrific,
here.
addition to our medical
Thank
staff.
you.
So
I'm happy
we're
to
happy
be
that you're
here.
here.
See
If you need to
patients.
see Teresa, her office is in Hoboken, right at 2 Hudson, right across from the path, and also in the medical office building. So please feel free to give her a call, and we'll see you next week on the Medical Center show.